Hi, my name is Negar and my topic for my presentation is staffing in hospitals and long-term care facilities. Here's a little cartoon. Hospital nurse staffing is a concern because of the effects of shortage has on patient safety and quality of care. Objectives for this presentation. Research on relationship between staffing and quality of care for patients. Stats on 2016 RN cuts and the effects of the burnt out. Patient adverse outcomes. Stress related to shortage of staffing. Signs and symptoms of burnout. Adverse event related to burnout and sleepiness. Nurse staffing and job satisfaction, and what can we do next? Stats from January 2016 to February 2016, within a 4-week period, 775 cuts were made. That is equivalent to loss of almost 1 million hour frontline RN care for patients. Ontario has 711 RNs per 1,100 patients. That's compared to an average of 841 per 100,000 people to the rest of Canada. Ratios can be used to better understand staffing levels between different areas of healthcare facility and examine relationship between staffing and safety, quality of care, value for money, and health of the workplace. I have a data here that shows in Canada the nursing unit with the highest staff to patient ratio is intensive care unit, and the lowest staff to nurse ratio is long-term care. So as you can see here, one nurse is put for one patient in intensive care unit and one nurse for as high as 9 patients in long-term care facilities. Patient adverse outcomes. Potential outcomes from inadequate staffing includes urinary tract infection, pneumonia, longer hospital stays, failure to rescue, decreased amount of purposeful rounds. Lower nurse to patient ratio. Lower nurse patient ratios, according to a study of 5 million patients, has shown 3 to 12% reduction in adverse outcomes and lower rates of complications, increased quality of care for patients, decreased medication errors, allows for hourly purposeful rounding, better communication among healthcare professionals. It is important that ratios are flexible according to patient needs, lower patient assignments when patients require more care. Doing my preceptorship on the medical unit, North Bay Regional Health Center, I've seen that RNs who have patients who need more care throughout the day will get lower assignments. And there has been times when a patient with cerebral palsy and trach care was there, and the nurse would get 3 patients instead of 4 during the day. Here's another cartoon. It says mom's shift must have gone better today. She made it closer to the bed before falling asleep. And I will be focusing on effects on the staff. Burnout symptoms. The term burnout was coined in the 1970s by an American psychologist. He used to describe the consequences of severe and high ideals experienced by people working in helping professions, such as doctors and nurses, who sacrifice themselves for others and would often end up being burnt out or exhausted. Burnout is considered to have a range of symptoms. There is no agreement which of those are part of it and which ones are not. But all definitions given so far have in common that symptoms are regarded as being consequences of stressful activities in or outside of the job. Some Signs and symptoms of burnout include emotional exhaustion, and that's feeling drained and exhausted, overloaded, tired, and not having energy throughout the day. Alienation from the job activities. People affected find their jobs increasingly negative and frustrating. May develop negative attitude towards their job and colleagues. Um, they may at the same time distance themselves emotionally and disengage from work. They also might see themselves in a reduction of performance. It will affect everyday tasks and at work as well as at home for caring for family members. Nurses experiencing burnout find it difficult to concentrate and experience a lack of creativity. They may also experience stress, which there's different kinds of stress, cognitive, that includes memory problems, inability to concentrate, poor judgment, trouble thinking clearly, being anxious, having racing thoughts. They may also experience physical stress, which that includes headaches, backaches, tension and stiffness, insomnia, increased pulse, weight gain, weight loss, and decreased immune system. Emotional stress will include agitation, restlessness, irritability, patience, being overwhelmed, depression, and having a sense of loneliness. And last one will include behavioral, and that's the most important one in my opinion, which is neglecting responsibilities. Adverse events related to burnout in nurses will include medication errors and risk own health and safety. Medication errors, sleep deprivation or burnout has adverse effect on performance of hospital staff nurses. Several studies have shown that failure to obtain adequate sleep is an important contributor to medical errors. Nurses who report an error or near a miss error obtain significantly less sleep than nurses who did not report an error or near miss. They will also risk their own health and safety. Sleep loss is the leading cause of drowsy driving and related vehicle crashes. Reduced information processing deficits, which makes it slower to respond to hazards, and also lack of sleep up to 20 hours can produce decreased performance equivalent to blood alcohol concentration of 0.01%. It can also impair hand-eye coordination, decision-making, memory, and speed. In conclusion, I strongly believe that the first issue that has been affecting a better care is staffing in healthcare facilities. Shortage in nursing staff results in staying extra hours of work under stressful conditions, which can result in fatigue, injury, and job dissatisfaction. Nursing suffering this kind of working environments are more prone to making mistakes and medical errors. Safe nurse staffing, meaning an appropriate number of nurses and other staff is available at all times, providing care within a suitable mix of education, skills, and experience to ensure patient needs are met in a safe and timely manner. Adequate number of nursing staff has been proven to strengthen patient care and safety. So decreased nurse-to-patient ratios will result in more time for bedside nursing, better patient education, safer medication administration, less nurse burnt out, and less nurse job dissatisfaction, which will all increase patient satisfaction and quality of care for our patients. Thank you very much for listening.